Listen, I want to talk to you a moment about symptoms and just the overall well-being of our body, our health. The media and a lot of times the medical profession is feeding us a lot of information that is generated because of business interests, not truth and reality. Symptoms are really misunderstood. With the exception of an acute injury, something, you hit your arm, you fall down a flight of stairs, you get into a car accident. Let's just say you broke a bone, even a broken neck or broken back. Within a few months, that is completely healed. So pain and symptoms as a consequence of that is really something else. And what I want to talk about is how important it is for you to get a second opinion, and not a medical second opinion that matches the first. I don't mean just getting if you got a medical doctor giving you an opinion, don't take me wrong, but if you go get a second medical doctor's opinion, they're still swimming in the same pool, so to speak. I'm talking about going to a completely different body of water. Come to the ocean. I'd like to think of myself as a vast pool of information because I'm not biased in terms of, I don't hate drugs, I don't hate surgery, I don't hate doctors. I just think there's an appropriate application of these things, and it's really important to find that appropriate application. Sometimes you need to go to the emergency room. Sometimes you need to take drugs for something, but most of the time you don't need to start there, and actually if you start there, you worsen your problem. Symptoms are the body's way of saying, hey, we got a problem. I like to give two analogies. One is if you grab a hot frying pan that doesn't have a rubber handle and you don't have a mitt on, it's going to burn. Well, number one, the pain is not coming from your hand. The pain is coming from your brain. That is your body's way of telling you, hey, get your hand off there, you're going to damage yourself. You do some sort of burn, some sort of tissue damage, and like I said before, it heals. A few months later, it would be ridiculous to think you're still going to have pain in that hand. 5 years later, 10 years later, imagine if your hand was still burning. But that's kind of how it works in our medical realm. And the problem is, it's kind of like it's just bad information. If 10 years later you still have chronic pain from an injury or an episode, it's your brain trying to tell you something else. There's more going on. There could be now organ referral. There could be confusion, toxicity in the nerves. There could be just a problem in the brain. But once again, a lot of times when we get injured, all the cumulative stress in our lives that's been manifesting, say, in our soft tissues, our low back, our neck, all of a sudden we get traumatized, we get injured, and then it kind of blows circuits, so to speak. So you got to go to the fuse box now and flip the circuits back on, not just the one that's injured or hurting. So if your back hurts, you have to assess the gallbladder, you have to assess the emotions, toxins, you have to assess electromagnetic pollution, you have to assess your diet, your blood sugar. There's so many different overlapping stresses that can keep something like back pain going, or insomnia, or even belly fat, even a dysregulated metabolism and blood sugar. So the second analogy I like to use is the cat's tail. If any of you have a cat, or you could use a dog, but if you accidentally open the door and the cat or dog's sleeping on the floor and you step on its tail, what's going to happen? Yeah, it's going to scream. Now, we don't run up to the mouth and look inside, make sure everything's okay, because, that's where the noise is coming from. That's the symptom. No. We have to remove our foot from their tail, right? And we could laugh about that or cry about that if you're a cat lover. But the reality is the symptom had very little to do with what was going on in the body. So I'm just going to challenge you right now. I'm happy to consult with you. I love giving second opinions and second chances because most people have been fed a lot of baloney about how symptoms work and their health works. If we don't listen to these symptoms appropriately, what's going to happen is I find most people start to develop cancer, diabetes, heart disease, depression, major symptoms, things that could take your life later. Remember your hand on that hot pan, it's burning, and it doesn't always mean that there's anything wrong with your hand, like the cat's tail. So you got to figure out, is it really, sorry to confuse you, is it really the analogy of your hand on the pan and you just need to let go? Or is it like the cat's tail where it's a referral from somewhere else? You really have to know, because if you get it wrong medically nowadays, you're basically subscribing to a life of symptoms, or you're going to take a lot of dangerous medications to make those symptoms go away. And what's going to happen year after year, your body's going to develop disease because it's trying to get your attention through symptoms, and eventually it's going to get tired and you're going to get disease or illness. So that's my my spiel. I just wanted you to take a moment and listen to this. Please call my office or send an email that you want a consultation. I will do it at my expense. It's a second chance, second opinion kind of thing, and I will speak very frankly and very straightforward, and I will not be biased in terms of the typical medical information that you're getting from your typical medical practitioners. Okay, thanks so much. 916-933-0974, 916-933-0974, or you can email me at drseanpatterson@gmail.com. Dr. Sean Patterson, DRSEAN, PATTERSON @gmail.com. Bless you. Have a great day. Bye-bye.